Good afternoon, good morning. I'm Dakota Gruner, the Executive Director of ID 2020. And we at ID 2020 are honored to have been selected as one of the featured projects at this year's Paris Peace Forum and excited about sharing our work with other participants. Digital ID has the potential to be the gateway for global social and economic development. If responsibly implemented, it offers an opportunity to improve both access to and quality of linked programs. However, for the 1 in 7 people globally who today are unable to prove their identity, digital ID means finally being able to access education, healthcare, and other social services, exercise their rights as citizens and voters, and participate in the modern economy. The current approach to ID and digital ID fails users, service providers, civil society, and governments. It leads to siloed information, significant privacy risks, inefficient service delivery, and perhaps most importantly, it takes control away from individuals. We talk a lot at ID 2020 about good ID, but what we mean by good ID probably requires some definition. What we mean is that your digital ID should accompany you throughout your life. It should be unique to you, accessible anywhere, and perhaps most importantly, you should control access to your personal data. To realize a future where all ID is good ID, ID 2020 develops and applies rigorous technical standards to certify best-in-class identity solutions, provides advisory services and implements pilot programs, and advocates with governments to protect user privacy and put control of personal data back where it belongs, in the hands of the individual. Since 2016, ID 2020 has set a standard for ethical, privacy-protecting approaches to digital ID. We do this by fostering collaboration between governments, the private sector, and civil society towards a common vision: good digital ID for all. ID 2020 approaches this challenge from a holistic, market-based approach. The ID 2020 certification was launched in 2019 at the World Economic Forum in Davos. It establishes 41 technical requirements, which offer solution providers a product development roadmap for good ID. At the same time, we are working with funders and implementers to adopt the technical requirements and certification as part of their tender processes, thereby creating market incentives to ensure that solutions adhere to the highest ethical and technical standards as they design their products. ID 2020 partners with leading solution providers, nonprofits, and governments to test these technologies in the field, in some of the harshest environments imaginable, to build an evidence base and apply those learnings as similar programs are replicated and brought to scale around the world. Good digital ID doesn't just happen. Since 2016, ID 2020 has advocated before governments, the private sector, and civil society to adopt the policies, regulations, and trust frameworks necessary to implement and ultimately facilitate the adoption of digital ID technologies by those who will benefit most. Our engagement with digital ID isn't just theoretical or even purely technical. We constantly test and reassess our assumptions against the complexities of implementing programs on the ground. Our programs enable us to impact lives directly by offering the benefits and mitigating the risks of digital ID for some of the world's most vulnerable populations in some of the most challenging settings. We expect our programs to adhere to the highest ethical standards, to produce meaningful benefits for the participants with minimal risk, and to contribute insights to the development of better practices and programs through rigorous monitoring and evaluation. Our work has taken us around the world. We currently have active programs in Thailand, Indonesia, and Bangladesh, and are quickly scaling globally. Today, I want to talk about our program in the Mae La Camp in Thailand. Established in 1984, the Mae La Camp is home to approximately 40,000 individuals who fled persecution and violence in the Karen state of Myanmar, and who were subsequently denied entrance by Thailand. The majority of residents have spent most of their lives within the confines of the camp, receiving services from a consortia of NGOs. All of their accomplishments, their health records, and personal information are tied to camp systems. But the camp will not exist indefinitely. It is already facing a growing shortfall of critical resources. When the residents ultimately relocate, the accompanying loss of their personal information includes qualifications that will leave them even more vulnerable. ID 2020, in partnership with the International International Rescue Committee, and iRespond, a nonprofit biometric provider, implemented a program to not only improve access to camp services, but to begin to give control of personal information back to the residents. We started with patients suffering from chronic health conditions who would derive the greatest immediate benefit from improvements to the continuity of care. Since then, we've extended enrollment to other healthcare services within the camp, including maternal and child care, immunization, and at the outpatient care clinic. Our next step is to continue to extend the program to livelihood services, beginning with 400 individuals already involved in intensive programs with IRC. These individuals are selected as they can provide more immediate feedback on risks and opportunities. Our hope is to ultimately give the residents the opportunity for them to build out a user-controlled, privacy-protecting, and portable digital profile of all of their camp information. This profile can then accompany them wherever they go. This version of a good digital ID platform uses a combination of advanced iris scan biometrics and the Hyperledger Indy blockchain to provide access to and store verifiable records. Trained camp operators guide each participant through the informed consent materials before capturing a biometric and biographical information for those who consent to participate. In line with our commitment to always prioritize the welfare of the individual, local IRC personnel regularly engage with the participants to better understand their changing needs, concerns, and challenges. Their input, along with that of community leaders, has been instrumental to guiding improvements in the design of the program. Even with our extremely considered approach to implementation, we have enrolled over 10,000 people as of the end of September 2020. This figure includes patients who are using the program to receive treatment for chronic diseases, mothers who employ it for faster and more accurate maternal care, or workers recording their professional attainment. Certainly, COVID-19 has presented an operational challenge for this program. Preventative measures for the pandemic are even more critical in this resource-scarce environment, and enrollment has slowed dramatically as a result. However, the partners are committed to ensuring that the program continues and are excited about its potential to transform the lives of residents. Where do we go from here? The opportunity. Locally, there are between 20,000 and 30,000 additional residents within the camp who aren't yet enrolled. Similarly, there are another 50,000 vulnerable individuals within the other 8 camps in the region. We, including IRC, our partners IRC and iRespond, want not only to offer the program to these individuals, but also expand the range of participating services, including those from other nonprofits operating in the camps. In any sort of future, the project will produce significant benefits. We are thoroughly evaluating the program, and the intent is to share the insights generated from this project openly to establish best practices for implementing programs like this for other vulnerable populations in other geographies. ID 2020 will itself employ the many lessons gained here to improve its other good digital ID programs, with the potential to reach millions of people around the world. In conclusion, thank you for joining us today or listening in at a later date. We believe that the potential of good digital ID depends on the active participation of a wide range of different stakeholders. The focus of this project is health, but digital ID is or will be critical to many other services or rights. If you're interested in learning more, several of our team are virtually here at the forum, or you can reach out to us at info@id2020.org. Thank you so much. I'm seeing a few questions popping up in the chat. Please, for anyone who's listening in, put those in and I'm happy to turn to them. So the first question is, how do you ensure the privacy of potentially sensitive biometric information collected, especially in contexts or with populations with limited privacy rights or ability to enforce those? That's an excellent question, and there's a few things that have been done. The first is that the organizations who are working with within this project, apologies, comply with the highest privacy standards. So whether the privacy rights and regulations that are implemented in Thailand are stringent, these are GDPR compliant solutions, and ones where we have selected them based on very careful designs for privacy and the security of the data. This information is never shared. The biometrics are held only by the partner organization, and are not shared with governments or others. And then one of the most important things, and I spoke about this briefly in the presentation, is around, I think the informed piece of informed consent. Trying to ensure that participants in the program understand the scope of where their data will be used or will not be used. And particularly because this is a model of digital identity that gives individuals significant and granular control over their own data, equipping the participants in the program with the ability to exercise that agency over what they're sharing and with whom. There are other questions? Question was, has the project faced any cyber attacks? No, none. There have been, I think, very stringent testing to ensure that there have been, all the security protocols in place, and monitoring of anything that could go wrong. And to date, no cyber attacks. Next question, why the focus on refugees for this pilot? Has the approach and model been applied more broadly on other types of populations? So the focus on refugees for this pilot, I think, is twofold. The first is that when we think about digital identity, and specifically digital ID that's privacy protecting and that's user managed and portable, I think the needs of refugees to some degree exemplify why so many of these requirements are so important. These are individuals who may need to prove who they are to multiple different institutions in multiple different geographies, hence the importance of portability. For, I hope, obvious reasons, privacy of their personal data is that much more important, perhaps, than privacy of data for the general population. And the necessity of individuals being able to share their information in a very granular and selective measure. And so, we believe that there was sort of tremendous need and tremendous applicability to reimagining and reconceptualizing digital ID as it relates to refugees, but that the user requirements that we're describing for refugees are ones that are critically important for absolutely everyone. And so to the second part of your question, yes, this approach and this model have been applied much more broadly. We're working currently with partners in the government of Bangladesh around using a similar model of digital credentialing for immunization records for children. Here, portability is important, not only because individuals get healthcare and kids receive their vaccines at multiple different sites, but that particularly with significant seasonal migration, there's need for those credentials to be able to travel with people as they move around. Similarly, important needs for privacy. And what we've seen is that in the context of COVID-19, many of these requirements have come to the fore when we think about how all of us are going to be able to get back to some degree of normalcy, to be able to travel, to be able to go to our employers, specifically when it comes to how will we prove that we've either recently been tested against COVID-19, or tested for COVID-19, or have been vaccinated against it. So the approach and the model are currently being applied to work on vaccination certificates once a COVID-19 vaccine is available. The next question, have we encountered any reluctance or problems with local authorities or local populations? No, there was, I think, tremendous engagement with local authorities and local populations in the design of this project. IRC, who runs much of the sort of day-to-day services within this camp, consulted heavily with the active community groups within the camp, and brought to them sort of this idea in a pretty nascent form in order to co-create. And so I think with that, there was significant sort of feedback early in order to test the premise, make sure it was something that the individuals believed was valuable, and therefore was in a position to discuss and move forward. I think one of the things that we have seen, and I again touched upon this briefly in the presentation, was around informed consent. There's a lot of sort of very sophisticated technology being used in this project. And this is a camp with relatively limited connectivity and little sort of digital literacy for many individuals. And so one of the things that I don't think I would categorize as a problem, but was certainly a learning for us, was sort of how that's communicated out to the general population, both the benefits and the limitations of the project. I think one of the problems we saw was that people imagined that the scope and the potential use of these credentials was wider in kind of the outset than it really was, and needing to be able to sort of say this is going to be useful in a limited set of contexts at the outset, and then will expand in scope as more NGOs and other partners are brought into this ecosystem down the line. But we didn't want to to sort of overpromise in terms of what the project could deliver in the short term. The next question was, does reliance on advanced technology, including blockchain, present challenges in some remote contexts or with populations with limited digital literacy? Great follow-up question to my last point. What we found is that the reliance on advanced technology certainly creates in some ways, the use of sophisticated technology needs to be context appropriate. And therefore, what we've found is that many of the solutions that are being brought to bear for decentralized digital ID are not immediately designed to solve for remote contexts or populations with limited digital literacy. And what that meant is that these solutions were being designed for you and me, or for those who are, those of us who are logging on to an online forum. They weren't being designed to be broadly inclusive. And so what we've done with the ID 2020 certification is really try and emphasize the necessity of designing solutions that are inclusive, that work, both off and online, that have simple, easy to understand user interface, and that are designed, really to be easily navigable. So, what we're trying to do with the certification is not only set a floor and some guardrails around privacy, security, auditability, necessary elements of what we believe defines good digital ID, but also to incentivize the design and then the adoption of solutions that are inclusive. Let's see. One more question coming in. Where did you get the inspiration for the project? So this was a project that, as I said, we did in partnership with the International Rescue Committee and iRespond, which is a nonprofit biometrics organization. And both IRC, IRC has long been, operational in these camps and providing many of the basic services I was touching upon, healthcare, education, livelihoods. And iRespond had a presence in Thailand and similarly had seen the sort of necessity of digital credentials for individuals in this camp. And so I think the inspiration from the project came from our partners. What I think we each recognized, and I think is so important, is that this is a population who fled Myanmar, at this point over 30 years ago. And you now have individuals who've been born in the camp or who have even been born to people born in the camp. And many are stateless in the truest sense of the word. And with that, they're very much at the sort of mercy of the sort of macroeconomic and geopolitical situation around them. And I think what our colleagues at iRespond and IRC have long told us is that for a long time there was sort of significant international international support for the individuals in this camp, and therefore, while it was I think certainly a difficult context, the sort of basic basic life needs were being met. And in recent years, with sort of shifting international focus to other crises, there has been simply less funding and less support going into these camps. And so, there's a real expectation that individuals will disperse from these camps in the not too distant future. And with that, a need for them to be able to prove that they have received specialized education or vocational training, that they have a clean bill of health. And so the inspiration really struck from, how do we ensure that even if these camps close, individuals, have a basis and a foundation from which, they can thrive. How do you collaborate with national institutions? I'm not sure whether the question refers to the national institutions in Thailand or national institutions broadly. Vis-a-vis this project and in Thailand, we've worked, largely through IRC and through iRespond with the Thai government and the Ministry of the Interior, and have ensured that this project sort of runs under all of the auspices of that office and that ministry. Broadly, we work with governments around the world, mostly on sort of the regulatory regimes that surround digital ID. It's our belief that privacy is absolutely fundamental, so we're engaged in a number of conversations, including some in the U.S. and most internationally, around digital privacy and digital rights, but also a lot of conversations around the levels of assurance perhaps required for somebody to prove their identity and access, let's say, banking. And so through our through the ID 2020 team's efforts, but also through the sort of extended reach of our alliance partners, we engage with sort of regulatory conversations around the world. So the next question was the environmental sustainability of blockchain use considered, and how do you mitigate the potentially high CO2 emissions over time? Excellent question. I will be the first to admit that I am not, a technologist by training, but certainly am concerned about and aware of the environmental, questions that surround blockchain. I think a few things to note. The first is that in the design of this project, while blockchain plays a role, it plays actually a very small role, and so the computational requirements are probably lower than suggested. There's sort of, if I could draw kind of a diagram of the entire technical architecture, you'd see sort of one very, very narrow use of blockchain in that architecture that doesn't require, processing all of the underlying PII. In fact, we believe it's incredibly important, and this is enshrined in our technical requirements, that personally identifiable information is not stored on the blockchain. So I guess one quick answer is that this is not sort of an entirely blockchain-based architecture, and so from an entire environmental impact perspective, it's lower than were that to be the case. In terms of how to mitigate the potentially high CO2 emissions over time, I think there's a whole host of different technologies for carbon CO2 mitigation that organizations are exploring. We haven't to date, sort of chosen a particular approach by which we would mitigate carbon impact for these projects. But I think what we've seen is that also that the sort of processing mechanisms that blockchain is using, different blockchains and different blockchain solutions are using around on proof of work and whatnot, are also evolving quickly. And so there's I think a significant hope within the blockchain community that that environmental sustainability will go up as there's sort of better and better solutions applied. Next question was, how does the exchange with refugees take place, and how do you explain the process of digitizing their identity to them? Here, I wish I had some of my colleagues on the line who have been with the refugees in person. I was there early in the project, but haven't been there kind of as the informed consent process has been updated and evolved. The exchange with refugees, we're using sites where they're coming in for services already. So we started with the chronic care program, and at the time, individuals would come in and they would show up in order to access a particular service or to receive care, and would present something saying, here's my name and here's the sort of care I'm coming in for. Oftentimes, individuals would show up with a book that was a paper-based book where they had been recording the past medical care that they'd received. And so much of the sort of explanation has been around, what happens if you lose your book, and how do we ensure that those records don't disappear if you were to lose your book, and making it around how do we maintain those records in a way that's safe, that's privacy protecting, and allows you to carry those records with you. So that's been one of the pieces. The other has been, around particularly the use of biometrics. For many of these individuals, they were receiving care from multiple different programs within IRCs. There was not just the chronic care condition, but they might also show up for maternal and child health, for example. And with that, this was suddenly a way for them to say, link the records to me, such that when I show up at the next site for care, that I can be identified and therefore I can receive care that's appropriate. And so that has been, I think, the kind of other piece of the narrative that's been important and resonant. Next question was, what is the most significant outcome of the project so far? I think that there are twofold. The first is, as I said, there are over 10,000 people who've enrolled in the project. And with that, we've seen significant improvements in health outcomes. When you had individuals receiving care at multiple different sites, there was often a gap in the continuity of care. And it became difficult for somebody who perhaps was diabetic. Let's say they would show up for something acute, nobody would know that they were diabetic, and it would be difficult for them to receive care that was appropriate for somebody with diabetes. And so, from a almost anecdotal level, what we've heard is just significant improvements in the continuity of care and the seamlessness of being able to provide that good care for these camp participants and for IRC staff. But I think the second outcome that I'd point to is really around the learnings and sort of replicating this model elsewhere. This is one of the first pilots of a sort of sophisticated suite of solutions, both the blockchain piece that was referred to earlier, use of biometrics in order to create robust, portable digital credentialing and digital profiles for these individuals, and done in a setting that's incredibly difficult. And I think what that's done is provide proof of concept, at a relatively significant scale, that these types of solutions can be brought to bear and do improve the outcomes for these individuals, and can be applied in low resource and low connectivity settings. And what that's done is sort of seed movement on a number of projects sort of around the world with similar aims, but where there have been questions around whether this can be done, like I said, in a low connectivity setting. Can this be done in a way that refugees or other individuals understand and are excited by? And so what we're seeing is sort of a rapid proliferation of projects that are taking this on as a model. Thank you. It's time.